I'm one of the community liaisons here at OSHIIP, and with me today I have Becky Hayward, who is also a community liaison. And we'll talk a little bit today about accessing mental health benefits if you're on Medicare. So Becky, can you tell me a little bit about how Medicare covers mental health services?
Yeah. So Medicare is going to cover mental health services the same way they would cover any other service. So anything that's outpatient is going to be through the Medicare Part B part of the program, and you have a 20% coinsurance. If you have an inpatient type situation, it's going to be covered under the Part A portion of Medicare, and you'll have that hospital deductible. If you have a supplemental insurance, it's going to pick up all of those extra copays. So the coverage is going to be exactly the same for somebody on original Medicare.
What would someone need to think about when they're looking for a mental health provider? Will Medicare cover most mental health providers? Is there a network?
So if you have traditional Medicare, as long as they're a Medicare biller, they're going to go ahead and use your Medicare card. So you're using your red, white, and blue Medicare card, and the doctor is going to go ahead and just bill Medicare traditionally. If you have a Medicare Advantage plan, you do need to make sure that the providers that you see are in network, and that is the only way you're going to get that care. If those doctors are out of network from your Medicare Advantage plan, it's not something Medicare is going to pick up. So you do need to make sure all of your providers are in network of your Medicare Advantage,
which is always a good tip for people on Medicare Advantage.
Yeah, and that would work exactly the same for any service under Medicare Advantage, whether it's a mental health service. So Medicare Advantage has to cover it the same the way traditional Medicare does, but they do require folks to go ahead and make sure they use the right provider, hospital network, and everything.
Yeah.
And then prescription drugs, you just got to make sure that the drug is on the formulary. So the plans have to cover the medication or an equivalent of the medication, and you just need to make sure that your drug is on the formulary and you're using the pharmacy network.
Yeah, so the same types of tips we give for other Medicare covered services.
That's exactly right, the same tips.
Yep. And if anyone has any questions on Medicare covered services, including mental health services, give us a call at OSHIIP at 1-800-686-1578.
For more information, contact OSHIIP at 1-800-686-1578 or visit us at insurance.ohio.gov. That's it for this week's episode. Thanks for tuning in. We'll see you next time.